Good afternoon, everybody. Thank you for coming. Thank you, Sue, for lunch and organizing all of this. We appreciate it. Hopefully you're in the right place. I know there's a lot of sessions going on. This is the one on community-based participatory research. And we're very excited to have you all here today. Hear a little bit from some of our panelists and some of the outstanding work that they do within our, not within, more with our community, right, to be more appropriate. And so without further ado, I'd like to jump right in and introduce our panelists. For those of you who don't know me, I'm Shawn Gerstenberger. I'm the Dean of the School of Community Health Sciences. And so I'll be moderating the session today, so hopefully you'll be hearing a lot more from them and less from me. So we'll start on the far side over there. I'd like to introduce to you Patty Cook-Craig. We're very thrilled to have her here today. She'll be telling you a little bit about CBPR in general, and she comes to us from the School of Public Policy and Leadership. We were just talking about name changes, so I wanted to make sure I got that correct, and from the Greenspun College of Urban Affairs, so thank you for being with us today. Next to her, we have Jennifer Keene from the Department of Sociology and Liberal Arts. Known Jennifer for a lot of years as a great community advocate and researcher, so we're thrilled to have her and her background here as well. And last but not least, we have Alexis Kennedy from the Department of Criminal Justice. We're thrilled to have her here, a recent award winner of our Community-Based Participatory Research Award. I saw that yesterday. Congratulations. So you're in very good hands here. If we could, I'd like to give them each just a minute or two to say a little bit about themselves. Then we'll go ahead and I'll give you the background, how the session's going to work today, and we'll go ahead and get started. So you want to go ahead and start, Patty?
Well, hi, everybody. Welcome. I am a social worker by training, BSW, MSW, PhD in social work, and I've done work over the years in what social work would call macro social work, mostly administration, program development, program planning. And I came back to academia really to try and figure out what works, which is why community-based work is really kind of what I gravitate to. I was at the University of Kentucky for about 14 years, and I've just been at UNLV for 2 years now. So I'm a little bit of a newbie to this community, but I'll talk about my work here in other places today, and I'm glad to be here.
Thank you.
So I'm Jennifer Keene. I'm a sociologist by training, and I'm a quantitative sociologist by training. So I used to do a lot of research in my office by myself with secondary data sets, and didn't actually have to talk to people. And then some stuff changed, and now I am doing work that I wasn't really trained to do, and feeling my way through all of that, and working on community-based projects. And I also am in the dean's office, so I have a little bit of knowledge about what goes on in our college as well, because we have a lot of people in the College of Liberal Arts, including some of my colleagues here, who are doing work in the community, and so I kind of wear both of those hats.
And I'm an accidental academic. In fact, for all of my degrees, my supervisors always said I'd never end up in academia. So I had a profession. I'm a recovering lawyer. And I was a lawyer and got really frustrated with the system and went back and did my PhD in forensic psychology. So I've never followed the rules. When someone gives me a rule, I break it on purpose. So I think that's why I'm a community-based researcher, because I don't actually care about academic journals. If you write something highbrow and 10 people read it, you're not really making a difference. So I like to really be in the community, and solving social problems and ruffling feathers is my preferred way to work.
Well, thank you all. We've got 3 great panelists today. Just a couple of logistics of what will happen today. First, what we'll do is we're going to have a short presentation from Patty over there to tell us a little bit about what is community-based participatory research. Some of you may know, some of you may work in that area, but it's a broad spectrum of things, so we'll talk about that a little bit. We'll then stop, and we will have a second for questions on that. We'll then go to the panelists, and we're going to hear specifics about their individual projects that they've worked on over the years, how they use community-based participatory research or in community-engaged research to enhance and make change in the community. I have a few questions that I would like to ask them, and then we can open it up to the audience. Given the fact that everything is assessment and evaluation driven, I was joking earlier, there's a few learning objectives, right, that we always put together on those, so I think I would be negligent not to do that. So when you leave here today, there's a few things we would like you to take with you. One is a better knowledge and understanding of what community-based participatory research is, how it works, and how you might engage with that, and hopefully meet some colleagues within this room that can assist you in doing that. Second, we definitely want you to leave with how this type of research aligns with our top tier initiative, and in particular, how this fits into the Carnegie classification of an engaged university. Those are critical things that we would want you to know. And then third, of course, we want you to make some new friends and colleagues across campus and hopefully become a productive and more productive researcher by interacting with these others. That is kind of the fundamental basis of community-based participatory research anyway, and then take these examples to improve hopefully what you do and how we impact our community as a university. I think it's been said many times, a good university is only as good as the community that surrounds it, and accordingly we need to be engaged with that. So without further ado, we will get to the folks that have some details for us about that. We'll go ahead and move over to Patty and ask her to share us a little bit about CBPR.
Well, first I want to start by saying I would really like to thank the Office of Community Engagement, particularly the work of Sue DeBella and Tamara Marino, as well as UNLV Libraries, who helped us pull together the resource guide that you can take away, which are some resources. And one of the reasons why I think it's so important to thank these folks that have pulled this event together today is because when I started out as an academic, I said a little bit in my introduction, I gravitated to work maybe just like Dr. Kennedy, which is around working with the community to solve problems. And we did not have things like this. We did not have conversations about how to do this work and how it differs from traditional research and research that you may more often see in academia. So for me, today is an opportunity to really start a conversation that would have been maybe altering in my journey as the developing the researcher that I have become. So I want to just, Dr. Gerstenberger talked a few minutes about the Carnegie classification. I want to just give you a definition of this classification, which defines community engagement as the collaboration between institutions of higher education and the larger communities, specifically talking about the different types of communities, including local, regional, state, national, or the global community. And so when we think of the definition community, one of the things we can think about is people define community differently. I've worked on projects where we defined a school as a community and really working with engaging with a particular one school or set of schools. For the mutually beneficial exchange of knowledge and resources in the context of partnership and reciprocity. And I think this concept of reciprocity in the research process is a pretty hallmark concept in thinking about how we understand community-based participatory research. You know, there's a lot of definitions of CBPR, and just today, kind of getting ready and enjoying our lunch, this panel was talking about how people's definitions differ. And so one of the things I don't think it's possible to do today is to all agree on what the definition of this is. In some ways, I think engaging in CBPR is a process. It's a philosophy of how you orient yourself to the research endeavor, to the research process. And so what I can't do is say, please agree that this definition is the best definition, but we want to we do want to talk about what it is to be an engaged researcher and a participatory researcher. So one of the things that I like to do to be able to kind of open up that conversation is to juxtapose what I'm going to call today traditional research with participatory or engaged research. And so I just have a little bit of a busy slide here, but I want to compare these two frameworks, and maybe that's a way that we can start to talk about how we define this work together. So we might think of traditional research as research that favors the engagement of a detached evaluator or researcher who is removed from the delivery of program planning and activities or of the enterprise of actually doing the work of that discipline. And juxtaposed to that, we have community-based participatory research, which might favor the collaboration of the researcher or the evaluator and key stakeholders in the planning of research and evaluation. And so you do these activities in conjunction with program implementation activities or in conjunction with the work of the discipline on the ground in the community. And you'll forgive me, some of the words that I'm using today are really related to the fact that I'm a social scientist and a social worker and a person who works with community organizations around human services and social services. So we might have to sub out some words here when I say program activities. You can also think of the work that the discipline does. That's a little bit of my paradigm. Okay, so if we think about juxtaposing these two paradigms, the traditional paradigm and the participatory paradigm, you can think of a set of questions that might be useful to talk about how they're different. For instance, what's the researcher role or the evaluator's role? What's the stakeholder's role? What capacity does the organization or the individual stakeholder who participates need? And who's responsible for the research? And so one of the ways I think about how we think of traditional research is we have this researcher or this evaluator who is thought to be unbiased, a detached observer. So this is a person who doesn't participate in the day-to-day work of the discipline or the program or the agency or the community. They come in for the purposes of the research or the evaluation, and by design they have that sort of wall between the work and the actual research. One of the things I want to point out about what people often think about the difference between traditional research and participatory or community engaged research is that engaged or participatory research automatically has more bias to it because you are working in tandem with that organization or that community all the time. I'd like to push up against that concept. I think all research has bias in it. So when I am in my office designing a survey that I'm going to give out to the world, and I'm not doing that in tandem with organizations, I'm introducing bias in some way into the way I define my operational definitions, into the way I word the questions. And so I think when you look at traditional research and you look at participatory research, it's not the idea that you are going to be biased as a researcher or unbiased, it's what bias do you have to manage. And so in participatory research, the researcher is often an engaged person, a member of a planning team. And so oftentimes in CBPR projects, you will actually be working with the community, the stakeholders, prior to any evaluation activities. As they're planning their programs, as they're planning community initiatives, you would be there. And one of the values of that that you don't often get in traditional research is before any activities have ever occurred, you can be helping them plan activities so that you can have meaningful research and evaluation, so that the questions are relevant to the product that you get at the end, so that when you analyze or evaluate a research question, it can be useful to the community to know what those answers are. When you think of the stakeholder role, and the stakeholders are like the organizations or the community persons who might work with you. In traditional research, stakeholders are the consumer of the research, right? So if it gets out of that journal, where only 10 people have read it, they're consuming your research and they're deciding what to do with that consumption. In community-based participatory research projects, they become a participant. And one of the things that you might hear that's different from different types of projects is that the level at which they participate or the pieces of the research process that they participate in can be different. So they might help you design the research questions. They might help you design the instruments. They might be data collectors for you. They may help you interpret the analysis. They may do all of those things, one of those things. And so you can participate with community entities or with stakeholders at varying levels, more or less work together. When you think of the organization itself, and this I think is an incredibly important point about doing CBPR work, you have to take into account what the capacity is of stakeholders or community members to be able to engage in those pieces of the project with you. So as a CBPR researcher, as a person who works with communities to engage in building projects together, I have had lots of experiences where organizations have a lot of capacity to be able to write their own questions or design their own questions, to be able to help me think out instrumentation. And I've worked with agencies who have very little capacity. And so then as a researcher that is engaged, part of what I'm doing is not just doing the research or the evaluation, I'm also helping to build the capacity of the stakeholders or the organization to work with me on the pieces of that project that they want to work on. And so if they want to be part of the design of the methodology and they don't quite have the capacity to do that, then we have to work a little bit ahead of time to help shore up that capacity, teach them what they need to know, or help them think about those things differently so that they can engage in that work together. And so in traditional research, the capacity level for stakeholders can be pretty low to understand the research process and the pieces of the research process that you're engaging in. But when they become a partner with you in doing this work, their capacity needs to be elevated. It needs to be higher to be able to understand kind of what they need to know to work well with you. One of the things that I find has been an incredibly important part of my job over the years is becoming a translator between academics and between community folks. We speak a language that doesn't really resonate outside this door, and so to be able to translate that to folks on the ground is very important, but also community organizations, community members, stakeholders speak a language that doesn't necessarily always resonate with academics. And so sometimes you have to be the person who can sort of work in two languages, if you will. And then I think it's important to think about who takes responsibility for the research. And so in traditional research paradigm, it's generally the researcher, right? They design the questions, they design the methodology, they do the research, and they analyze and have their findings, and they're thought to be the expert on this work, and they are responsible for owning it. But in community-based work, it's a shared responsibility. And one of the things that you can get out of engaging in community-based work, based on this kind of philosophy of I'm a team member as a researcher, but you're an equal team member as a community participant, is this shared responsibility, this buy-in to ownership of the product. And that ownership then can increase the likelihood that people will want to use that research to the betterment of their organization or their community. And so I think that shared responsibility can promote a lot of buy-in. I think what you're going to hear in a few minutes, though, that for all the good things that you can get out of CBPR, it is a high hill to climb sometimes to say, not only am I going to engage in research, but I'm going to have this sort of relationship with the community. I'm going to take some ownership and participation in building capacity alongside doing the work of the research. And also, by the way, I'm going to give up some of the ownership of the decision making in how the research gets designed and done. And so rather than give you a laundry list of everybody's different definitions and steps of CBPR, I think it's really useful to think of this sort of juxtaposition between, what's it like to be in your office kind of designing everything and getting to make all the decisions, and what's it like to share those decisions and share that work together. And just one more asterisk I'll put in here. We're using today community-based participatory research, CBPR, as sort of our hallmark term. We're also using engaged research, but there are lots of names that get thrown around. Community-based participatory action research is another common term. A model that you see more contemporarily is empowerment evaluation. I've engaged in that. These models all have a little bit of difference about how people define them, but it generally centers around this concept that we are participating with the participatory is an important word. We're participating with the community, and that there would be some level of action between us and between the folks that we're working on with and on behalf of in the community. Okay, so let me stop there and say you can take entire classes on this kind of research. So that's a very short kind of introduction. Does anybody have any kind of burning questions, comments that you want to start out with? I think that's where I'm going, right?
Sure. Yeah,
Shawn?
we can take a couple quick ones there. Kyle?
Yeah.
So I'm very interested in the capacity level because I've spent a lot of time taking research and translating it to audiences so that it's meaningful to them. And I'm wondering, is there a way that you can do both components in terms, because I know there's pressure for tenure and earning that and publishing for those sources and translating it for other audiences, or is that just too difficult?
Both
of a task?
components, traditional and CBPR. Well, I will throw this to the panel too. But one of the things I would say is you pick a paradigm based on what the conditions on the ground suggest is a better paradigm. So there are instances in which I would not engage in CBPR, because, that first of all, maybe the organization isn't philosophically aligned with that. They want a detached evaluator. Or maybe the capacity issues are so salient that you really can't do that for the project at hand at the time, right? So I think there are times in which you would choose one or the other. I've also been on teams where there's both, and that can be extremely valuable for managing the bias part. And I'll throw that over to the panel.
I mean, it's a risk when you're pre-tenure and you're doing this really practically based stuff that's going to be a report to an agency first, or testimony to the legislative session. It's impactful, but it's not counted the same as the traditional research. So there was a real relief to get tenure and then to be able to say, all right, I'll throw my, one article a year, but let me get back to the stuff that I'm really passionate about that doesn't, you also have to learn how to sell it for your annual reports. And that was a tricky thing, because I had a dean say to my friend, and I both do practical stuff, that we had to stop shaking hands and kissing babies and focus on academic research. And it's just such a shame, because the professional reports, we can see the impact when it turns into budget changes and legislative changes. So you sort of have to dig your heels in, or be prepared that it's not given the weight it should.
I would just add that I think it depends on the organization or the community that you're working with, right? So their capacity in some ways is a little bit of a code word for like ability, right? Or an ability, I don't mean intelligence, I mean time, or human capital, people who can actually do the work in that organization to actually partner with you. Some organizations really just want someone to come in and do the research, and because they don't have time to actually fully engage. And so I think the key to that, though, is really clear communication, which is hard, right? So when you're trying to start a partnership with an organization or with a community, and actually really trying to be clear about what your goals are and what they actually can contribute, and then how that actually affects the reality of the roles. And those I think can be challenging conversations, but they're kind of important, and so that you know whether or not it's even doable. What you're envisioning is actually doable for them as well.
And I'll just say one more thing. Also, institutions vary. So there's
Right. Yeah.
Opportunity to look at other institutions.
Yeah. I've been at so I've only been here 2 years. So I've been at other institutions that use the word translational research a lot, right? But don't live translational. Yes. And so they say we're an institution that promotes translational research. But then when you look at the evidences for tenure and you look at what kind of comes out of annual evaluation reviews, they're not really interested in promoting translational research as much as they might say they are, right? I also think it varies by department or college within an institution.
Yeah, it definitely does. And I think as we move into some of the examples that we're going to hear, I think you're going to see some hybrids of that, some that are really community-based, some that are research-based that turned into community-based, and probably some hybrids. And the statement you made earlier, I mean, this is it's another tool in the tool belt of research methodologies. It's not the do-all, end-all. It's not the right thing for every place and every time, but it's a very powerful tool when it works effectively. And it's another one you want to definitely be aware of. So I think that's probably a good segue to maybe hear a little bit about, from each of our panelists, some of the research that they have done that engage this methodology, and a little background. And so, Patty, you want to keep going down there?
Sure, and then I'm going to shut up after a little. So the example I guess I would say probably was the most impactful. I was a new academic, and I was invited into the room. I do work in violence prevention and also in homelessness as well. But in this case, I was invited into the room with some coalition and state folks in the state of Kentucky, and they were looking to work with the CDC, because the Centers for Disease Control and Prevention, because the CDC wanted states to redesign how they how they organize their prevention programming to prevent sexual and interpersonal violence. So I got invited into the room to talk about being their evaluator, and the CDC was telling states, hey, you need to use this paradigm called empowerment evaluation, which is CBPR definitely. And so we started talking together, and really states, Kentucky was only one of 51 states or 50 states, the District of Columbia and territories, that were being asked to redesign their work, but they really didn't understand what they needed out of evaluation, and then, so they were sort of struggling. We decided to work together, and at first it was sort of a labor of love. It really hit that lane of me wanting to do what works and figure out what works, and they were wanting to redesign prevention programming and test it. Along the way, they were asked to be part of a 6-state demonstration project to redesign their prevention programming and to evaluate it. And all of these 6 states were told the same message. They were told, you need to use evidence-based programming. And so those states asked the CDC, well, great, tell us what the list of evidence-based programs are and we'll do it. And the CDC said, oh yeah, we don't have a list of evidence-based programs. Kentucky, and this was not me, this was the practitioners on the ground, so it was the coalition and all the rape crisis centers across the state. To their credit, they said, and they were the only state that said this, they said, well, look, if there's no evidence-based programming, we need to find a program and we need to test it. And they said, hey, Patty, can you help us with that? And at that point, we had $0. But they wanted to do the work, and so we started working on this piece of building capacity to do that together. Ultimately, they picked a program, and they decided to push that program out statewide so all the rape crisis centers could do it together. They made that decision to do it together so that they could get enough evidence to test the question about whether or not it worked. That was a historic decision for them. And I'm happy to say that all of that work really resulted in them getting a $2 million evaluation research grant from the CDC to be able to test it. So they got we did a 5-year randomized control trial design. And so this was a great story of how you engage with the community for a few years and you could get something big, which is meaningful to the institution. And it really elevated their status as a coalition and as a state, as a state who's really trying to do this hard work of redesigning prevention programs. So it was a beautiful thing to watch. Most of it wasn't me. I was just lucky enough to be in the room when they said, hey, will you work with us to figure this out? And so I think that's my best example. There were really hard days and hard conversations, though. And I definitely got the message. I started this out my first year as an assistant professor, and I definitely got the message, why are you spending all this time at the state capitol when you should be doing research, and are you going to get tenure? And that CDC grant helped me get tenure, for sure. Mm-hmm. But at the end of the day, for me, I have to orient my work that way. It's what gives me meaning as well, and so that's my example.
Thank you. Jennifer, you mind?
So it's hard to follow her. She's very, very good at this. So as I alluded to, I have not been trained in this. I'm a sociologist, and I'm interested in lots of different issues related to social inequality. And I was part of an initiative, and some of you in the room are probably do remember the CORE initiative on campus that was an attempt to try and create interdisciplinary collaborations among faculty on campus. And I was one of the people involved in that. And I don't really want to talk about CORE, but I would say that through that process of trying to create interdisciplinary teams and trying to get research going that was collaborative, I was introduced to a local philanthropist who I had never met before, and turns out to be someone who knows everyone. And he was interested in kind of community goodwill, philanthropy, and also like just community engagement and trying to kind of change the narrative that we all have from living in Las Vegas, right? So I don't have to tell you all that Las Vegas, we get kind of negative about living here. We have this kind of trope that nobody's from here, nobody knows their neighbors, everybody's a little grumpy, it's hot, there's no real engagement here. People don't feel like they're from here, so they don't give back here, right? And lived here. That's not true. We know that that's not true, but it's part of kind of the narrative that people tell about Las Vegas. And so he was really interested in trying to see if we could have a community conversation about volunteerism. And so I had these conversations with this one person who knew a lot of people and said, would you be interested in doing research about volunteerism in Las Vegas? And I said, okay, yeah, because I was also kind of sick of this idea that nobody lives here, nobody cares, because I knew that that wasn't true. And so I was like, yeah, let's do an empirical project where we actually try and change that. You know, we have something that says, like, actually, we have evidence that there's a lot of people very, very engaged in this community and really giving back in lots of meaningful ways. So I had one connection that then turned into like 100 connections. And the genesis of this project was him and me having an understanding that this was of interest to both of us, which was really important. And then it turned into, well, let's talk to some other community groups. And he started kind of hooking me up with lots of various networks. The mayors got a whole nonprofit community group that I got to talk with and get their input on whether or not they would be interested in research on volunteerism. What kinds of questions would they be interested in answering, right? So I was doing a lot of listening, like a big listening tour. I talked to like 20 different organizations and lots of leaders in town saying that we're in the nonprofit industry and using volunteers for their programs, saying, well, what are your challenges with volunteerism here? And what are you interested in? What would help you? What kinds of questions, if I could get data on it, what kinds of things would help you in your organization? So I was gathering a lot of input, and that's where, I guess, in some ways, I guess on the spectrum of community-based participatory research, this feels very much about community engagement. It was really community-informed. So I talked with CEOs of nonprofit communities. Then we did a survey of volunteer coordinators within the nonprofit community in Las Vegas and asked them, well, what are your challenges? What are the barriers? What do you think is going on? What do you need to know? What would you like to know about how to increase or capture what is actually going on in terms of volunteerism in Las Vegas? And then once we had input from them, we designed a survey that we eventually disseminated through them to the volunteers, the existing volunteers in their various organizations. So I still didn't have to leave my office very much, except for a lot of lunches, a lot of conversations. Lunches and meeting people in their offices and asking lots of questions and really trying to understand what people's concerns were and what their reality is in their organizations with their volunteers and what kinds of things could I help do? You know, I often, in a lot of those conversations, I say, listen, I'm the nerd. You know, I'm the nerd here who I have some skills, I know some stuff, I'd like to help you. How could I help you? And so, because they're doing the real work. They're doing the real community work in their nonprofit organizations. I want to learn about that and study that, but I'm still not doing the work that they're doing. And so I really recognize and I value that distinction. I value what they're doing, so I want to help. So I would frame a lot of our conversations like that. But eventually we did another survey of volunteers in organizations in the nonprofit community, kind of all over Nevada, not just Southern Nevada. And we called it the Nevada Volunteerism Research Initiative, and it started in 2013. And I say I'm the director of that, but it's actually a very collaborative process. And there's a whole set of research results. And so we had a little bit of seed money, not a lot of seed money, but we had a little bit of seed money. We built a really fancy website, nevadavri.org, that has our report and like all the stuff that we learned. And so once we actually put this report together and got all these results that we were hoping would be useful answers to the community, we sent it directly back out to them. It's totally public facing. And then we kind of went again on a little bit of a tour to kind of get the word out about, look, we did this research and there's a whole bunch of really interesting findings and you might think about that and you might think about that and you might think about that. And hopefully this is all can be used in trying to kind of help change the narrative. We actually found that there's a lot of volunteerism in Las Vegas, which you knew, right? Because you volunteer in lots of ways in Las Vegas. You give your time, you give your money, you know, and you might not walk around with the hat on that says, I'm a volunteer, but you do it anyway, right? So there's a lot of uncaptured volunteerism that's going on in Las Vegas. And if we were to really try and capture it, we're doing better than we ever give ourselves credit for, basically. And so going back to the philanthropist, you know, that he's a community organizing mover and shaker. So he takes this news and he goes back out there and tries to, and uses this as empirical support for the good work that is actually happening in Las Vegas. And then for my purposes as well, I already had tenure, which is this tenure thing is a really important part of this, all of these stories. I was already a full professor, so I could do this. I was in an administrative position. I could take the time. I could actually none of my career was hanging on this project. And that's really important to note. It came at a moment in my life and in my career that I could do this and take the time because it's unfolded over a number of years. And the output, the products of that are like two research papers, two published papers, which I'm happy about and I'm proud of. But it wouldn't have gotten me tenure. 2 papers would not have gotten me tenure, right? So it would have had I done that kind of work earlier in my career, it would have had to be in tandem with a lot of other work. And this is, academics we're very strange. This is a bubble that we live in that really, all this stuff about translating our language and our even our work culture is really, really alien and foreign to the rest of the world, let alone Las Vegas. And so we have to do a lot of work to try and translate that, but also to make it mutually beneficial. Like we can't sabotage our own careers in order to do community work, right? We have to explain to community members that what we need to get out of this, which is so that we can keep our jobs and so that we can continue to do this kind of work. So that's another thing that in talking with community organizations, I try to explain that. Like, they don't know, and we shouldn't expect them to know. We have to be clear to them about what we need out of this. So if it's a couple of publications, or if it's some sort of award or some other kind of recognition that can go on our vitas and be part of our career yes, again, we have to kind of fight for in the culture that we live in, but I think it's an important piece that's all part of this and is why I've been able to do it. So anyway, I could for a really long time.
Well, thank you, Jennifer. Obviously, 2 very different projects right out of the gate.
Totally.
I think probably a good segue into a third one.
I've done about 15 to 20 community projects, so I don't even know how to describe how they come about. And I think part of it, when I started pre-tenure, I very much had service as an important part of my life because I came out of law and the world of politics. My mom was a politician. So there was a part of me that always felt like I had to be in the community doing research, doing stuff for free, because that's what I can offer. So I would go to agencies or nonprofits and say, would you like me to evaluate your program, and just write a 4-page summary of who your clients are, what your needs are, because then you can use it to write grants. You can use it to open doors. So I would spend weekends, and I'd go to 2-3 days and sit down in an office, and they'd bring in the wheelbarrow full of files, and I'd flip through them and code them and turn it into this little thing that wasn't necessarily research per se, but it's about building those relationships. And that, we were going to talk about ethics, because with IRB, we always think you have to get it approved, you have to have the questions, and then you go. For me, it was like, you don't need IRB if you're using your professional expertise, which meant that when I finished the report, it was owned by the agency. And most of the time I'd say, can I have the de-identified data and to use for research purposes? And then it becomes secondary data analysis, but they have the right to say no. So I have done surveys or evaluations or interviewing stakeholders or whatever the agency needs. And at the end of it, when I write a report, they go, thank you very much, and lock it away. And I can't do anything about it. I can't share the report findings, and I can't use the data. So there's always that risk. But building those relationships and people realizing that you're going to come through, you're going to help. I remember once I was doing one for a foster group that works with foster kids here. And I took one of my colleagues down because he said, look, I've got 3 days. Normally, it's also about labor. I bring my grad students with me. And I just tell them, guess what? Thursday and Friday, we're going to go to an agency and we're going to read a bunch of files, and everybody's got their spreadsheet, and I make it sound like fun. And I took one of my colleagues, and she had her PhD as a new person, and she goes, I've never been to a social service agency. And I was like appalled. It's like, how have you never been to a women's shelter or a kids' home or a community-based organization, and you've got a doctorate and you're telling everybody how to run their things? So I just think the hands-on experience is really important too for our students. And when it gets really rough, because I took some students down to look at juvenile sex offender files, all of those students are now attorneys in the community, so whenever they see me, even though it's been like 10 years, they're like, I still remember those file reviews. I'm like, I'm sorry. So, but it's the real world. Like, we have to teach our students about the real world. They need to see the agencies. They need to meet the people that are in the programs. They need to understand what it's like, because if we just stay in our ivory towers and write these policies, we're just disconnected completely. So I sell my students that the work is work experience, and I tell them they can put on their resume that they coded data, that they worked at Metro, that they worked at juvenile, the Juvenile Sex Offender Squad of Probation and Parole. Like, I make it so that I train them, or I teach them a bit and say, you can write down on your resume that you got this special training, and that they can say, list the project on their CV. So I have to sell them on why they want to give me the free labor. It's just being creative and problem solving. And those relationships build. Like, each little thing that you do, yeah, you might have lost a long weekend working on it, but you've now got a relationship. So if you have something else come up, those people trust you, and you can go in and you can get access. I think I'm one of the first researchers who has full access to Unity, which is our child welfare system. And honest to goodness, it took me 6 years to get that. Full background check, fingerprinting, everything. It was crazy. But you're sort of putting in the work. For me, it was easy because I'm helping improve services for children, or I'm helping make things run more efficiently, or I'm helping agencies be better at applying for money so there's more money for kids. So I could always see the reason why you do the work for free, but it wasn't traditional research. Like, it wasn't something that you filed for your IRB, had your lit review, started. So it's a really different approach, and as long as you're in it for the long haul, it's always going to pay huge dividends, which is important. Plus, the true experts are the community members, the people in the trenches working with the kids. They are working with adults or whoever. They have the stories, they have the expertise, they know what they need, they know what they're struggling with. There's nothing worse than I see academics go into meetings and they're kind of like, oh, I'm Dr. So-and-so, and I'm going to tell you how the world works. And people shut down in an instant. And that's not our job. We're here to help problem solve. We're part of this community. We're going to make things better for kids and families. And it's attitude. It's very strange. Some people here at UNLV are just a little bit off-putting. And so they'll be invited to a meeting or a task force or something, and you can just see them shut down the room in a split second. So I don't know. I don't know if I answered the question.
No, that's fine. And if you don't mind, I'd like to indulge the group for a second, because I come at it from a very different perspective. I'm trained as basically a biophysical scientist. I'm a toxicologist by training. And so I got exposed to this on one of my very early projects as a master's student. I was doing fish consumption advisories in Wisconsin, testing fish for mercury. And so, it's simple, right? You go to every lake, you get every fish you can, and you grind it up and you test it for mercury, you publish a report. Well, there's thousands of lakes. It's not horribly relevant to anybody to do it that way. So we got working with the American Indian reservations, and we started to test fish on those. And at some point in time, somebody pulled me aside and said, here's the question you really want to ask. And for me, that was really a turning point. I'm getting everything I can get, right? I'm a grad student, get as much data as I can, analyze it, go everywhere. They said, here's the question you want to ask. You want to know, from these walleye that we spearfish in the spring, are they contaminated with mercury, and can those cause adverse health effects in the population we work with? And I said, boy, that's a really good question. And it was a total gift. And I went back and sat down and I said, that's a very wise individual, and I should listen to them. And so we started to work on these projects. We wrote grants together. But as the question was earlier, was there some basic standard research that was done? Yes, we could still go to those lakes and test those fish and publish a series of articles, but under the umbrella of this is what the community wants to know. And I could still publish those. And then it really started to go to a whole new place. Once we received those fish, they want to know, well, we don't cook them the way everybody else does. Could you look at the cooking practices? Do you bake? Do you boil? Do you fry? Is the skin on? Is the skin off? What temperatures do you use? Because all that can impact the contaminant burden and the amount they're getting. So we wrote several grants I baked and boiled and fried fish for one summer, and then analyzed all those, and then we had different parts of the fish because different cultures and different tribes and locations, some ate the liver, some ate the cheek meat, some boiled the whole things into a stew with the head and the guts and the whole 9 yards. So we tested all those different ways, and it just was a wealth of projects that me as an individual sitting in an office would have never thought of. And so that project went on. We wrote grants with them. I mean, I started as a master's student. I got a PhD. I did a postdoc. I got a tenure track job. And I started to publish those articles down the road. And I mean, I got tenure off that project. And I did that back in Wisconsin, but I got tenured here, you know, a long, long time ago. But that investment got to the point where we were invited to meet with the tribal elders, with the medicine men. We would go to individual meetings where they would determine what lakes would be spearfished each spring, what type of fish they would consume from those areas. And in fact, we were collecting the fish at the dock from the individuals, and they would come in, and we were allowed to take those fish from them, which is, you know, unheard of. And so just a phenomenal interaction because the community said, this is what we want to do, and we had some skills that complemented them, and they had skills and ideas that really drove the research design. Just a tremendous opportunity. And this is from a person who was trained to work in a lab and never talk to people, right? And so I've evolved, and you know, I've realized that there's a tremendous amount of benefit from engaging them. Even if it's a biophysical science project, there's still, if you're not answering the questions they want to know, they are not engaged, they're not going to care. It's really important.
But that's really important what you just said. So I think a lot of academics can be very introverted, like we're odd in lots of ways, even especially socially, and this is not work you can do just via email. You have to talk to people, and that's good for us. We should get better at that, right? And so this is all very, very interpersonal conversations and interactions that are crucial.
Yeah, and that, for me, I mean, that was what started and really got my whole career going. We had a series of CDC grants back in the day when ATSDR was the Agents for Toxic Substances Disease Registry. We really had millions of dollars. We probably had $5-6 million of funding with those tribes. I got to tour 3 different states, 13 different reservations, turned it into epidemiologic studies. We did questionnaires, we did hair samples, we did blood samples, we fed the fish to rodents, did endocrine studies, did outcomes. I mean, I just published like crazy for this. And so, I mean, it was one of the best decisions ever that someone somewhere said, this is the question you should really ask. And so, you know, I learned to listen pretty quickly on that, what the community wants. So along those lines, just I think a broad array of examples. I wanted to throw that one in because it's not just a technique that can be used in the social sciences. It definitely is a broad-reaching technology that's very beneficial. So maybe a question to follow up on that is maybe we could talk a little bit about what is that spectrum of research that falls into this community-based participatory research. It can be a lot of things. Maybe you could just give us a few examples of what you've seen in this area.
Well, in the College of Liberal Arts, we have a bunch of people who do this kind of work, and it's kind of hard to get your arms around all of it. But we have a public history program that is, you wouldn't think about history being a public thing, but it is totally community engaged. It's about historic preservation. It's about figuring out what in the community, what parts of the community wants to be preserved. And you know, documenting and all the history, right? And in a place like Las Vegas, that there's so much destruction, right? We take things down, you know. So they're really super engaged in lots of various pieces of Las Vegas. We also have people, and then they also include graduate students, and there's training going into all of that in the public history program. That's part of their graduate training. We also have people like Anna Smedley-Lopez, who's done an incredible job with her project called Slices, which is a student learning, service learning in sociology. She's embedded a service learning component into a class where she's got undergraduates going out and collaborating like incredibly well with local organizations and getting real experiential learning and building relationships that could eventually turn into, I should let you talk about it, but anyway, we've got some real like student engaged service learning going on as well, which is really different than the kind of community-based work I was doing, right, where you've got real undergraduates doing it via a class. Is another model.
Yeah, we have internship programs. So if I've got a big research project or an agency that wants, like say Judge Voy wants someone to code, I'm looking at my student who did that once, wanted to code all of his certification hearings. So it's like, I've come in and do this research for me. So, you know, I'll set up an intern where they'll be doing it for the term, knowing that they're going to be going in 1 day a week for 15 weeks, because it takes that long to do the file review. But in doing that, the students get the research experience, but then they also can often turn it into like master's thesis data or things like that. And it just really is figuring out, especially because I work with, you know, victims of violence and children, and really I'm working with data that would be impossible to get. If I started from the traditional point of view and went to the judge or went to probation and parole or went to child welfare and said, can I see your data? It's just like an instant no. It's children, they're protected, they're victimized. But if I'm already in the system helping them solve their problems, look at their output, getting them to think differently about how to make our meager resources go further, when I say, hey, look, if I took a deep dive in this, you know, I'd have a report for you, I don't want to say life is sales, but it kind of is, because by helping them, I'm just getting access to data that I never would, but most importantly, I'm helping the system run smoother. I'm helping, you know, the money go further. So it takes a bit of creativity and thinking outside the box, which we get very, you know, if it's not a class or it's not on a textbook, but we can't work that way, especially if we're going to be engaged in the community. So, you know, explaining to students that they can get credit for it or internship or just, you know, add it is a really, we have an unlimited workforce in our students.
Well, and they can also get jobs from that.
Absolutely,
Right, that actually
yeah.
happens, yes.
And they build relationships, and that follows them into their careers, and
Absolutely
it's
And
huge.
if I could just take
Sure.
that question a little bit differently. So I've seen we talked a little bit when we were preparing for this about the continuum of the amount of engagement stakeholders and community members have with us. And so I've seen a whole spectrum of like the project I was describing where they were embedded in working as part of the research team, these agencies across the whole project. So they were data collectors, or they gave us questions, and they did all those things. But I've also seen projects where community partners will say, you know, here's the piece that we really want to engage with you on. We want to help define the questions, or we want to help make sure that you're asking them in a way that's salient to our population using the kinds of interviews or instruments that we think are important. And so when I think of spectrum, I think of you can have people have a lot of activity across the whole research endeavor, or maybe at targeted points.
Sure. So we've been fortunate. There's a few that we worked on together in the past. I was fortunate to be able to write the Southern Nevada Strong proposal, if you've heard of the Southern Nevada Strong. One of the pieces of funding we got on that was to do neighborhood assessments using ethnographic research. So we actually hired 13 graduate assistants from all across campus that were assigned out into those communities that interviewed individuals on their views of the communities. So I think this is something Southern Nevada Strong has done really well. And then they have another piece of that. There's a really cool phone app that they have for pedestrian injury and safety and communities and walkability, where you can go online and community members can click and take pictures of things that are troubling to them. You know, like our gated communities where there's a grocery store across the street, but it's a 3-mile drive to get there because you can't get out. And they could upload those, and then we would compile those and bring in community work groups to evaluate and say, this is the problem. My kids can't cross the street, or I have to drive to my mailbox. This is ridiculous. You know, things that are design issues like that. So it's just another piece of that really broad spectrum of how to engage in the community. And you can even bring in those digital components now, because there's a very engaged digital community as well too. So I think that's one of the interesting questions. So you've already hinted on, you know, some of the realities and issues related to doing community-based participatory research. Is there anything else that you'd like to highlight in that area?
Because I work with victims, I also have to sometimes think psychologist rather than researcher. Like every time, if I'm going to be doing interviews or even exposing my students to the files, it's like am I going to trigger people? Like, you have to weigh, am I being exploitive by asking these questions, or, what is the purpose? So sometimes researchers are like, yeah, I'm going to ask 1,000 questions and tell me about everything awful that's ever happened to you, without thinking of the consequence of doing that interview. So I waffled between wanting to protect these people who've already been asked 1 million times their stories versus what's the utility. So when we do ask them, like right now I'm interviewing human trafficking victims, you want to make sure they're really empowered, and you're focusing on their resilience, and you let them know they're the expert and this is the purpose for asking these questions. Because we can get into our heads and be like really excited and want to ask everything and not think about the damage we could be doing to the people we're working with.
Yeah. Well, I think we have to kind of wrap up the formal questions here, so we have a few minutes for audience questions. Do we have any additional questions for our panel? Okay.
Jose Miller, School of Community Health Sciences. And you're, as faculty, doing this kind of work. I was wondering, because I know we talk about it on the Community Unit Council, but I think there's a lot of things happening on campus, but they might not be calling it community-based participatory research. In your experiences and your interaction with the faculty, are you seeing some of that? I mean, are you seeing that they're just not familiar with the terminology or the definition of what is CBPR or CBPR action leadership? Have you seen some of that, or what are your thoughts on some of that?
So I'll just say yes, definitely. I think sometimes people aren't identifying the activities they do as community engaged, and I'm sure the Office of Community Engagement really struggles with kind of identifying all of those projects. And I think sometimes I have experienced historically that people have differing ideas about what you can call CBPR, right? So some people have very, I think, pristine ideas about it has to be engagement across the whole spectrum of the project versus pieces of the project. And so I think sometimes those definitional issues that we talked about at the beginning, and there's different terms as well, right? So sometimes those definitional issues and those sort of feelings about paradigm of what counts and what doesn't count make it difficult. And so that's why I think it's just incredibly important, the kinds of work that like offices of engagement do and that institutions of higher learning do in order to sort of promote the connection that people have with the community and identifying what it is they're doing and what the value is of doing that work. I mean, we've talked a little bit about value being things that academics can get out of it. 10-year research articles, we talked about the value that community can get, but there are a lot of ways to define that value, and it's really complicated. But yeah, I see a lot of people doing this work, and they would never say, I'm doing it, right? Yeah.
And yeah, we're so siloed on campus, and so I think, like, just thinking of, we have a behavioral health coalition, which actually Community Health was part of, but haven't been showing up. But it's, nursing, psychology, educational psychology, social work, marriage and family therapy. But it was interesting because we'd been meeting for years talking about placements for our students, and all of a sudden 1 October happened, and everybody rolled up their sleeves and were out in the community, and we knew each other, and we could lean on each other because we had created this continuum, partly because of the development of the medical school and, getting to put input on the importance of behavioral health. So we need more of those really practically based, where we overlap, because you'll find someone on another side of campus doing the exact same work as you, and you're just like, where'd you come from, and how come we've never talked?
That happens way too often.
What can individuals do to be better prepared to conduct this type of research other than attend this event? We have some folks from the libraries here who can talk about the library guide too.
I think they have to leave campus. I mean, go to public hearings, go to community meetings, learn who the people are, like actually do something other than coming straight to campus and going straight home. So, I mean, because they need us to testify at legislative hearings, and they need us at the community meetings, and we don't. You don't wait to be invited. See what's happening and show up, I think.
Yeah, I think one of the things we have also talked about amongst ourselves is just about being prepared. So, like I've said now, 6 times now that I wasn't trained to do this, but I've been reading literature about it, and actually, if you read that literature, there's a lot of people who say they weren't prepared, so they're trying to prepare others, right? So some of it is just basic trying to get yourself educated about something, but another thing of it is really the institutional context, right? So there's there's a lot of people on campus, back to your question, Jose, I think that there are a lot of people who are doing this, wouldn't necessarily call it that or identify that, but the way that these kinds of relationships happen are in some ways systematic and in some other ways totally spontaneous and weird, right? And so just trying to understand what kinds of research and what kinds of relationships anybody on campus has is a challenge, I think.
And I would say, and pointing to the library guide, I would say that, this is where being in an academic institution helps you. You need to really work on understanding the paradigm and when you should be using it, and how you connect up to that paradigm. So, you don't always use CBPR. It isn't always appropriate, and sometimes it's very appropriate and we don't use it. But a good example I think I could give is I would never get a data set and say I'm going to analyze that data set using hierarchical linear modeling without learning about and understanding how to do hierarchical linear modeling. And I think the way in which you approach your methodology should be thought of in the same way. How you approach the methods of doing a research project should be studied, should be understood, and you should select that approach based on its relevance to the project and to whether or not it's right. And so I think you have to be a student of it.
And we did have a handout for you all that is the library's guide on this, and we will post a link to the guide that the library's produced. Star, or anybody else in the library want to say anything about that?
Yeah, on the top of your handout too, there's a URL there. So this is some selections, and this is some of what is on that guide. It's expanded on the website, and there's some links to online video tutorials, different places that you can learn more about CBPR and see some of those examples too. And we are academics, so reading the literature is a good start. But also, like, with those questions about like how can this still help me toward tenure? How can this kind of satisfy the different needs that you have, that you feel to be involved in the community, but also be kind of meeting your expectations here, there, looking at that research will, you can look at some examples of what other people have done.
Did we have time for one last question or no?
One last question, sure.
One last question, Kathy, you had your hand.
Hi, so Kelly Lochner, and even though I'm retired faculty emerita from campus, I still coordinate corporate challenge to try to get you out of your office and coordinating with other people. But my question is, do you stay involved with your organizations outside of the work day? Because if you become a perpetual volunteer like me, now you become a politician like me. So what happens outside and off campus for you?
Well, I'll tell you one thing, is that some of these, I just told you about one thing, but I've had other partnerships with organizations that I thought were going to turn into a research project and really just couldn't, weren't going to happen. But I still volunteer, I still offer help. I serve on their boards, I give them advice, I try to find other ways of supporting those things. I mean, we live here, so, these things are kind of boundless in a lot, there's the research, right? You have to invest and do stuff that you can to help the community, whether it's,
Draws you in.
yeah, I think so.
And I would like to say about that, I think that is a negotiated conversation with your community partners. So I have seen relationships fall apart where community partners perceived that people were going to stay around and that they were becoming, building a relationship that was going to last, whereas maybe the academics felt like it was a more time-limited project, like they were going to do the project and move on. And so negotiating that relationship with the organization about what it really means to do this work and how long that will last, I think is important, for sure.
Well, I'd like to thank you all for coming. Hopefully we've met the objectives, that you learned a little bit more about community-based participatory research, what it is, the broad spectrum that it covers, the things that it can and cannot do, how it fits into our Carnegie classification and ranking of an engaged community, how it contributes to top tier, and hopefully that you met some colleagues here that you could collaborate with and interact with. I know our panelists will be around for a little bit if you want to talk to them, but if we could please ask just acknowledge our panelists and thank them for their time in coming today. So.